Come in.
Hi, how are you doing today?
Good.
Cool. I'm Molly. I will be your nurse today. I'm just going to do a head to toe assessment on you. Can I get your name and date of birth?
Kirsten Medill, 10/29, 1998.
Okay. And what is the season out?
Well, it's snowing, so it is winter.
All right, that looks good. All right. So kind of how it's going to go, I'm just going to ask you some questions today, but then I'm also going to get into inspecting and listening and feeling for things on your body. I'm not judging you on any certain things that you say to me. I am just trying to better your care. And for me to do that, I just need to know the honest information to provide you with the best care possible. So first, I have a few questions. Have you ever smoked?
Nope.
No. Have you ever had any alcohol?
No, I'm a nun. We're not allowed to.
Okay. Have you ever been in the hospital?
No.
No? Okay. Have you ever had any surgeries? Have you ever been diagnosed with anything by a medical practice?
Nope.
No? All right. Are you sexually active?
I'm a nun, so no.
I just wanted to make sure. Can't just always assume in this profession. And then, are you on any medications, herbal supplements, over-the-counter medications, anything that I should know about?
Nope.
Or is there anything else you would like to tell me in confidentiality or anything that I should know about before I move on with the assessment?
I think we're good.
No? Okay, well next I'm going to do your vital signs. Are you having any pain today?
No, I'm all good.
Okay, no pain anywhere. That's awesome. I love to hear that. Next I'm going to take your blood pressure. If I had a blood pressure cuff, I would do her blood pressure. Does your blood pressure run about normal?
Yep.
Yeah, so about 120/80. That's good. So next I'm just going to assess your pulse. I'm just going to listen for about a minute and listen to your pulse. Your radial pulse. Alright, your pulse was about 66 and your respiratory rate was about 14. So that is all good. I'm just going to check symmetry on your brachial and your radial pulses. And then I'm also going to check your skin integrity. Any abnormal bruising or scratches that you've gotten lately that you don't know what they're caused from?
Nope.
Your skin looks pretty good. Moisturized, warm, got good circulation going on. I'm just going to check capillary refills and your clubbing of your fingers. And then once I check that, I would put a pulse ox on your finger if I had a pulse oximeter, but I do not, just to check your oxygen. And next I'm going to just test your strength. Oh, don't let me push down. Don't let me push up. Right? Don't let me push out. Don't let me push in. And then I'm just going to have you shrug your shoulders for me. Don't let me push down. Just testing your spinal accessory nerve. And then can I have you rotate your shoulders, kind of get some circumduction going on and checking your range of motion. That looks wonderful. Next I'm going to move on to your head and assess your head. Your symmetry of your face looks wonderful. That's always a good thing. I'm just going to check for any abnormalities on your head. So I'm just going to feel for that, feel in your hair. Alright, just check your hair. You got some dandruff going on. Do you normally have any dandruff?
A little bit.
Yeah. It is kind of a dry season. Just checking your occipital lymph node. Alright, that looks good. Next I'm gonna check your eyes. Do you have any sensitivity to light before I begin?
Mm-mm.
Alright. So first I'm just going to have you look at my pen and then focus on my ear or something further away. So focus on my pen, focus on my ear, on my pen, back to my ear. Alright, your accommodation looks good. Next I'm going to have you follow my pen with only your eyes, so don't move your head. We're just checking the 6 cardinal fields of gaze. Alright, that looks good. And next I'm just going to shine a light in your eyes just to get your reactivity of your pupils. Check your perla. Right. Alright, that looks good. And then I'm just going to have you, that was checking your oculomotor, your trochlear, and your abducens, cranial nerve. Next, I'm going to move on to your nose. I'm going to check your nasal cavities. If there's any pressure at any time, let me know. That's your frontal sinus and your maxillary sinus. Let me reopen my computer. Alright. No pain when I'm putting a pressure on that. Alright, I'm just going to check your nose, inside your nose. Alright, your nose looks very moist inside of there, so that's good. No abnormalities in your nose. I'm just going to have you close your eyes, and I'm going to have you smell something, and it's not going to be a bad smell, but just let me know what you smell when you smell it. Whoopsie. Alright, whatever. I'll pick it up later. Alright. Just gonna have you go ahead and smell.
Vanilla.
Alright, go ahead and open your eyes. Alright, next we're just gonna check your facial nerve. We're gonna just do a sharp and dull kind of thing on your face. This is dull. This is sharp. Alright? Alright. Sharp or dull? Sharp. Dull. Dull. Alright, good job. Here's that for you. I'm just gonna have you clench your jaw for me. That was your trigeminal nerve. I'm just gonna have you do some facial expressions, like can you smile? Frown for me. Do another funny face. Alright, that looks good. So your facial nerve looks good. I'm just gonna have you stick out your tongue. Right? And then can you open your mouth and say ah? Ah! Oh, the movement there looks really good. Alright, and then can you lift up your tongue for me? Alright, that looks all good. So I'm checking your hypoglossal, your vagus, and your glossopharyngeal cranial nerves. Next, I'm just going to check the alignment of your ears, and the alignment of your ears looks really good. If I had an otoscope and all that stuff, I would do a more in-depth exam, but I do not. So next, I got all of your face. So next, I'm gonna have check your alignment of your trachea. And then I'm also going to check your lymph node. So we got your preauricular lymph node, your postauricular lymph nodes, your cervicular, up and down, your submandibular, your submental. Go back down. You can just stretch your shoulders up a little bit, just so I can check your supraclavicular. Right, that looks good. And then your occipital lymph node all look good. Next, I'm just going to check your skin turgor. I'm sorry if that hurt you. That looks good. You look nice and hydrated. Next, I'm just going to palpate and listen to your carotid artery. So first, I'm just going to palpate. Actually, first, I'm just going to listen. All right. Ooh. Alright, next I'm just going to palpate your carotid. Are you sure you're okay? I don't even feel it. No, I'm just kidding. There we go. Alright, that's good. Got symmetrical carotid. Next, I'm going to have you flip around. We're going to take a listen to your lungs and check your symmetry. You can stay covered up if you're a little cold, because I know it's a little chilly in the room. Next, I'm just going to palpate your thyroid. So I'm just going to have you look straight for me. Alright, your thyroid feels good. That's good. Alright, and your skin looks good. Everything looks good. And I'm just going to move your shirt up for you if you don't mind. Alright. Alright, and next I'm just going to percuss the back after I listen to your expansion. So I'm just going to have you take a nice deep breath in. Alright, your expansion is nice and equal. Now I'm going to percuss your back. If there's any pain at any time during this assessment, please let me know. Alright, and next I'm just going to listen to your lungs, and every time I listen to your lungs, you can take a deep breath in for me. Keeps locking on me. And if you get lightheaded at any time, please let me know. Alright, because we can stop and take a breath. Alright, a deep breath in for me. Another deep breath in for me. Deep breath in for me. Deep breath in for me. Another deep breath in for me. Deep breath in. Deep breath in. Good. Deep breath in for me. Deep breath in. Deep breath in. Deep breath in. 2 more. Alright, sounds good. Your lungs sound nice and clear. Thank you for that. Let me just fix your shirt. Alright, next I'm just going to have you go ahead and lay down for me flat. Get you in a supine position. Let me cover you up. Are you cold? A little bit. Alright, I'll just cover you up. Now I'm just checking for your jugular venous distension, and that looks good. So if you'd like to prop up your head a little bit when I go on to do the rest of your assessment. Oh yeah, thank you. There you go. Alright, and next I'm just going to check your heart. So I'm just going to pull your shirt down. Yeah, perfect. Thank you. I'm just going to check the skin first, and then we're just going to check listen to some spots in your heart. Alright. Alright, and I'm just going to go to the second intercostal space to listen to the aortic and the pulmonic. And we got your aortic on the right side of your heart at the second intercostal space. And then we have your pulmonic on your left side of your heart, on the left side of your chest at the second intercostal space also. Alright. And then we got your herbs at the third intercostal space. I'm sorry. Here, we can pull this up a little bit to give you some privacy. What? Alright, and then we got your your tricuspid valve at the 4th and 5th intercostal space. Nice strong heartbeat you got. Alright, and then I'm gonna listen, you can pull these up. Listen to your 5th intercostal, or at your 5th intercostal space, I'm gonna listen to your mitral valve. Nice and strong heartbeat once again. And then I'm going to listen to your apical pulse for 1 minute. Alright. Let me flip this around first. You can relax. Ow. All right, that's a pretty good heart rate. You got a heart rate of about 68, so pretty accurate. Next, I'm just going to move to the abdomen, and I'm just going to inspect your abdomen at first. Make sure there's no abnormalities. I can see the pulsation of the aorta there in the middle. But first, I'm just going to look at it, and then now I'm going to listen to your abdomen. And once again, if there's any pain throughout this assessment, please let me know, because I will stop. All right, and I'm going to start in the right lower quadrant of her abdomen and move up and listen for vowel sounds. Dang it. All right. And then I move to the upper right quadrant. And then your upper left quadrant. And then your left lower quadrant. All right, and then next we're just going to listen to her aorta. And then her renal artery. And then her iliac arteries. And then her femoral arteries. All right, that all sounds good. And next I'm just going to percuss your abdomen. Alright, that all sounds good. And next I'm just going to do some light palpitations. And like I said before, if there's any pain during your assessment while I'm doing this, please let me know. I feel so weird. Alright, and then I'm just going to do some deep palpations. I'm sorry, does it hurt?
I did not like that feeling.
I'm sorry. That's all good. Alright, you can put your shirt down. I'm just gonna palpate your femoral arteries. Under. No, I didn't. Alright, those are symmetrical. Alright, now I'm just gonna assess some pulses down there and some other things on your legs. We got your femoral arteries. We already palpated, so I'm just going to do your popliteals. Thank you. Oh. strong pulses. I'm going to do post-tibialis. Alright. And I'm just going to do pedialis. Alright, all your pulses seem very symmetrical, so that is good. Uh-oh, what happened to your toe here?
I broke it.
What'd you do? How'd you break it?
I dropped the dish on it.
Oh, that's not good. Well, it looks like it's getting better. It's healed. It looks like, I mean, you don't have a boot on, so. Alright, your capillary refills in your toes look good. Your toes are a little chilly. That might be because it's kind of cold in here, so, nice. And then next I'm just going to have you sit on the side of the bed, yep. Then I'm going to just test sharp and dull again for you. I'm just going to have you close your eyes. Same thing as the face. Alright, sharp, dull. Alright?
Sharp. Dull. Sharp. Sharp. Dull. 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 Sharp.
Sorry.
Sharp. Dull. Dull.
Alright. Good deal. And then next I'm just going to test your reflexes. Alright. Oh, my bad. There we go. There we go. That looks good. And then next, can I have you put your socks and shoes on for me? While we're doing that, I'm just gonna take a look at the paper, make sure I don't forget anything. Spiked head. Alright, and you can just sit down for me for a second. Alright, I'm just gonna check over my papers, make sure I don't forget anything. Alright, I'm just going to have you go ahead and stand up for me. I'm just going to have your hands to the side. Oh, I don't think right now, and then I'll move it down. Thanks. I'm just going to have you close your eyes, have your hands to your side, and I'm just going to test your balance for 30 seconds. Alright. With your eyes closed. Sorry. Alright, that is good. Alright, next I'm just going to have you walk to the door and back, heel to toe, just like this. Yeah. Alright, and then walk back for me. Alright, and then I'm just going to have you walk normal to the door and back for me. Alright, and I'm just going to have you sit back down for me. I'm going to check edema. When I was checking your pulses, your edema looks pretty good. You didn't have any retention of water or anything. So how is your diet? How many times a day do you typically eat?
3 times at least.
3 times a day? Alright, and then how, for your meals, do you typically finish all your meals?
Mm-hmm.
Alright, would you say it's a healthy meal?
Yeah.
Yeah, you typically have all your fruits and vegetables, your carbs, and everything else. Okay, that's good. Do you drink a lot of water in a day? Do you stay hydrated pretty good?
I do, yep.
Alright, and then exercise? How does your...
5 times a week.
Oh, okay, cool. When you exercise, what kind of exercises do you do?
I either work out or I run.
Okay, and like working out, like you
Lifting
lift
weights,
weights?
yeah.
Okay, that's really good. On the off 2 days, do you just kind of lay around, or do you kind of like?
I don't lay around.
But you do
Yeah,
work. You
yeah.
stay mobile.
Yeah.
All right, that's good. So I'd give her about a Braden scale of 23, which is really good. You're not at high risk of ulcers, so that's really good. All right.